Have you ever stopped to think that your body might be giving you warnings long before a stroke actually happens? For many people, a stroke feels like something sudden, unpredictable, and impossible to anticipate. One moment, everything seems normal, and the next, life changes completely. But in clinical reality, that is rarely the full story. In many cases, the body begins to send signals days, or even weeks, before a major event occurs. The problem is not the absence of warning. It's that most people don't recognize it. I'm Dr. Sarah Collins, and after working with older adults for more than 3 decades, I've seen firsthand how often these early signs are overlooked. Not because people don't care about their health, but because the symptoms can feel subtle, confusing, or easy to dismiss. Before we go further, it's important to understand what a stroke actually is. A stroke occurs when the normal blood flow to the brain is disrupted. The brain depends on a constant supply of oxygen and nutrients, and when that supply is interrupted, even briefly, brain cells begin to suffer. There are 2 primary ways this can happen. The first is an ischemic stroke, which is the most common type. This occurs when a blood vessel supplying the brain becomes blocked, often due to a blood clot or a buildup of plaque inside the arteries. When that blockage forms, blood simply cannot reach certain areas of the brain. The second type is a hemorrhagic stroke. In this case, a blood vessel inside the brain ruptures or leaks, causing bleeding into the surrounding tissue. This bleeding creates pressure inside the skull and damages delicate brain structures. Although these 2 types of stroke occur differently, they share one critical fact. Both can have severe and life-altering consequences. But here's something that may surprise you. In many cases, the body begins to show early warning signs up to a month before a stroke actually occurs. Let's take a closer look at these signals. One of the most dramatic and alarming signs is a sudden, severe headache. This is not your typical headache that builds slowly or improves with rest. It's often described as a thunderclap headache, a sudden, explosive pain that reaches maximum intensity within seconds. People often say it feels like the worst headache of their life. It can appear without warning, even when you are resting, and may be accompanied by nausea, vomiting, sensitivity to light, or changes in vision. While not every severe headache indicates a stroke, a headache like this, especially if it is new or recurring, should never be ignored. Another early sign that is often dismissed is persistent, unexplained fatigue. This is not ordinary tiredness after a long day. It's a deep, overwhelming exhaustion that doesn't improve with sleep. Some people describe it as feeling drained all the time, as if their body has no reserve energy left. Even simple daily activities can start to feel unusually difficult. This type of fatigue can quietly interfere with normal life and is often overlooked because it develops gradually. Changes in cognitive function can also begin to appear. You may notice difficulty concentrating, forgetfulness, or a sense of mental fog. Tasks that once felt simple may suddenly require more effort. Conversations can become harder to follow, and organizing thoughts may feel frustrating. Some individuals even experience language difficulties, struggling to find the right words or clearly express what they mean. These subtle changes can build over time and are often mistaken for normal aging, when in reality they may signal something more serious. One of the clearest warning signs is something known as a transient ischemic attack, or TIA. This is often referred to as a mini-stroke. During a TIA, stroke-like symptoms appear temporarily and then disappear, sometimes within minutes. Because the symptoms resolve on their own, many people ignore them. But this is a critical mistake. A TIA is one of the strongest indicators that a major stroke could occur in the near future, and it should always be treated as a medical emergency. Your heart can also play a role in stroke risk. An irregular heartbeat, particularly a condition known as atrial fibrillation, can increase the likelihood of blood clots forming. These clots can travel through the bloodstream and eventually reach the brain, where they may block a blood vessel. Some people notice a fluttering sensation in the chest, a rapid heartbeat, or an irregular rhythm. These symptoms should never be dismissed, as they may be directly connected to stroke risk. Vision changes are another important warning sign. You might suddenly experience blurred vision, double vision, or even a partial loss of sight in one or both eyes. These changes can occur suddenly and without pain, which makes them easy to ignore. However, they may indicate that blood flow to parts of the brain responsible for vision is being compromised. Balance and coordination can also be affected. Some individuals experience persistent dizziness, a spinning sensation known as vertigo, or a general feeling of unsteadiness. Walking may feel different, and maintaining balance can become challenging. In some cases, coordination issues appear, making tasks like writing, buttoning a shirt, or handling small objects more difficult than usual. One of the most recognizable warning signs of stroke is weakness or numbness on one side of the body. This can affect the face, arm, or leg, and often appears suddenly. You might notice a tingling sensation, followed by a loss of strength or control. In the face, this may appear as a drooping expression on one side, making it difficult to smile evenly or close one eye. In the arms or legs, movements may feel heavy, weak, or uncoordinated. Even if these symptoms come and go, they should always be treated seriously. Speech and language changes are also common. Some people begin to slur their words or have difficulty speaking clearly. Others may struggle to understand conversations or follow instructions. Finding the right words can become frustrating, and communication may feel effortful or confusing. These changes can happen suddenly or develop gradually over time. Finally, high blood pressure remains one of the most significant risk factors for stroke. Often called the silent killer, it can damage blood vessels over time without causing noticeable symptoms. Many people are unaware they have high blood pressure until a serious event occurs. Regular monitoring and proper management are essential to reduce stroke risk. The most important message to take from all of this is simple. Your body often gives you signals before something serious happens. These signs may seem small or unrelated at first, but together they can form a clear warning pattern. Recognizing these early symptoms gives you the opportunity to act, to seek medical attention, address underlying issues, and potentially prevent a life-altering event. If this information helped you see these warning signs more clearly, consider sharing it with someone you care about. You never know who might need it. And if you want to continue learning how to protect your brain, your heart, and your overall health as you age, make sure to subscribe and join our community. Together, we can take simple steps today that make a powerful difference tomorrow.